You're watching Let's Chat.
It's so great to have with me on the show today, Summit Physical Therapy, Kevin Kostka, co-owner. Thank you so much for coming on the show today.
Thank you for having me.
You bet. Today we're talking about laser therapy and dry needling. What is that?
Yeah, so laser therapy, it's been around probably 15, 20 years, but recently we've had an advancement in laser therapy. So now it's what we call a class 4 laser. So it's a lot more high-powered, and you can get the treatment in a lot more efficiently. So what the laser does is it actually helps to stimulate and facilitate the healing process. As we age, we don't heal as quickly as we used to. So it will actually help to reduce inflammation. It actually gets absorbed through the skin and into the mitochondria, which is a fancy word for the energy of the cell. So it gets into that mitochondria, it creates what's called ATP, that's basically energy, and it helps with the cellular repair process. So it can really help to facilitate healing. It releases nitric oxide, which is basically vasodilation, so it brings more blood to the area, which you need from the attrition from all your, from everything that you eat, so it helps you heal a lot quicker. It's really been a game changer.
Now, you treated very successfully, may I add, my lower back with dry needling, my lower back arthritis. Who else is a good candidate for laser therapy and dry needling?
I mean, anybody could really be a good candidate for laser therapy or dry needling. It just helps to facilitate the healing process. Sometimes you need to get the muscles to relax. My fingers and my hands can't get deep enough into a very specific muscle, so the dry needling can get into the specific muscle that we needed to hit, let that muscle relax finally, get that blood flow back to the muscle. It would help to push out all those pain mediators, all the pain cells, increases range of motion, decreases pain, and can increase the activity of that muscle. So anybody could really use it.
And I know the needles are intimidating, but there's almost no pain. I don't know how that works, but it wasn't like getting pricked by a million needles.
Oh yeah, no, I mean, I've been doing it for quite some time, so I kind of know the tricks of the trade to be able to do that. And they're almost as fine as your hair, so
right.
It's very thin.
Is dry needling and laser therapy a complement to physical therapy, or is it a treatment on its own?
Yeah, no, great question. So it's a complement. If you just go in and do the needling, you're not getting back to the root cause of what's actually causing the concerns. So yeah, can I get rid of your pain with dry needling or laser? Absolutely, but we're not going to get to the root cause. We're not going to get to if it's a muscle imbalance, if you need stability, if you need range of motion. It's not going to necessarily all of the other concerns that you may have. Such
thorough work you do here, and that's why I've been so happy as your patient. So tell us how we can get a hold of you.
Yeah, sure. You can get a hold of us by phone, 423-777-4974, or you can find us on the internet, on the web, summit-therapy.com. That's SUMMIT-therapy.com.
What about referrals?
Yeah, so we take all insurances, but at the same time, in Tennessee, you don't necessarily need a referral either, in most cases.
And you have many clinics in the area.
Oh yeah, we have 7 clinics here in Chattanooga, proud to serve the Chattanooga community, and then we also have expanded into the Knoxville market as well.
Perfect. You are a great teacher. Thank you for coming on the show. So summit-therapy.com, head on over to their website, learn more about dry needling and laser therapy, how it can help you, how it complements more physical therapy for your pain. Thank you again for coming on the show, Kevin.
Yeah, thanks for having me.